Here, welcome to EduNet channel. Welcome to the last episode of the 2018 Kerala Assistant Professor in Nursing exam question paper discussion. And let's go to the first question. Cavalier uterus is a feature of which of the following condition? And the options are hourglass contraction, uterine inversion, endometriosis, abrasio placenta. And the correct answer is abrasio placenta. So the Cavalier uterus is also known as uteroplacental apoplexy, and it is a rare condition and it's a non-fatal condition resulting from the extravasation of blood into the uterine musculature. Let us go to the next question. A primary gravida is admitted in the labor room. She is in the active stage of labor. She is getting inhalational analgesia for pain control. Which is the commonly used inhalational analgesia? And the options are halothane, nitric oxide, Endonox, bupivacaine. So the correct answer is Endonox. Endonox is nitrous oxide in oxygen and it provides moderate pain relief and is safe during the labor. Let's go to the next question. A primary parturient is in the second stage of labor. Head of the baby is delivered, but there is no progress in labor even after 2 minutes. As a midwife, which of the following measure you will adopt to overcome the situation? And the options are perform Savanelli maneuver, administer IV oxytocin to increase the strength of contraction, wait for 10 minutes for spontaneous delivery, perform Muck-Roberts maneuver. And the correct answer is perform Muck-Roberts maneuver. So let's see what is Muck-Roberts maneuver. It is a procedure to correct shoulder dystocia during childbirth, and it is performed by pressing a pregnant woman's legs against their abdomen. So it is safe and effective. Let us see what is Savanelli maneuver. Savanelli maneuver is used in the management of severe fetal shoulder dystocia by pushing the head back into the vagina and delivering the infant by cesarean section. Let's go to the next question. Use of windows in the second stage of labor is contraindicated in, and the options are persistent occipito-posterior, failure of secondary powers, preterm delivery, preeclampsia. And the correct answer is preterm delivery. So the use of vacuum is avoided to assist the delivery before 34 weeks of gestation due to a perceived increased risk of birth injuries in preterm infants. Let's go to the next question. A nurse is monitoring the fetal heart rate of a woman in 38 weeks of gestation using CTG. For interpretation of the fetal heart rate, she should know the baseline fetal heart rate, which is between, and the options are 100 to 200 beats per minute, 110 to 150 beats per minute, 120 to 180 beats per minute, and 100 to 120 beats per minute. And the correct answer is 110 to 150 beats per minute. So let's go to the next question. Which of the following is not a component of Bishop's score? And the options are station of head, consistency of the cervix, position of the head, cervical dilation. And the correct answer is position of the head. So the most common modification to the Bishop score is a simplified scoring system that just takes into account dilation, effacement, and the station. So each is scored with 0 to 3 points. In this shortened modification, a score of more than 5 is considered favorable. So let's go to the next question. A woman in the fourth stage of labor developed a severe postpartum hemorrhage. Which of the following is a complication of severe postpartum hemorrhage? And the options are Cartagener syndrome, Asherman syndrome, choriocarcinoma, Sheehan syndrome. And the correct answer is Sheehan syndrome. So Sheehan syndrome is a postpartum hypopituitarism caused by the necrosis of the pituitary gland, and it is usually the result of severe hypotension or shock caused by massive hemorrhage during or after delivery. So let us see the other options. So let us see what is Cartagener syndrome. It is a rare autosomal recessive genetic ciliary disorder, and it contains a triad of situs inversus, bronchiectasis, and chronic sinusitis. Situs inversus means it's a rare genetic condition in which the chest and abdominal organs are placed exactly mirror image to the normal human anatomy. And Cartagener syndrome is characterized by the defective movement of cilia, and it leads to recurrent chest infections, ear, nose, throat, and symptoms, and infertility. So let us see Asherman syndrome. So in this, there is intrauterine adhesion or synechia, and it occurs when scar tissue forms inside the uterus and or cervix, and usually it occurs after surgery of the uterus or dilatation and curettage of the uterus. Let us see what is choriocarcinoma. So it is a malignant fast growing tumor developed from the trophoblastic cells. So trophoblastic cells are that help the embryo to attach to the uterus. Let us go to the next question. A primea gravida presents to the labor room at 34 weeks of gestation with acute abdominal pain for 2 hours, vaginal bleeding, and decreased fetal movements. She should be managed by, and the options are immediate induction of labor by oxytocics, immediate cesarean section, magnesium sulfate therapy, watchful expectancy. And the correct answer is immediate cesarean section. So let us go to the next question. During the infertility workup of a male partner, semen analysis shows most of the sperms are in abnormal form. What is the medical term used to denote abnormal form of sperms? And the options are teratozoospermia, asthenospermia, azoospermia, aspermia. And the correct answer is teratozoospermia. Let us see the other options. Asthenospermia means poor sperm motility. Azoospermia means is a medical term used when there are no sperm in the ejaculate. And aspermia means complete lack of semen with ejaculation. Let us go to the next question. Blood volume in a neonate is, and the options are 85 ml per kg of body weight, 75 ml per kg of body weight, 65 ml per kg of body weight, 95 ml per kg of body weight. And the correct answer is 85 ml per kg body weight. So the expected pediatric blood volume in premature infant is 90 to 100 ml per kg, and in a full-term newborn it is 80 to 90 ml per kg, and infant from 3 months to 1 year it is 70 to 80 ml per kg, and for a child greater than 1 year it is 70 ml per kg of body weight. Let us go to the next question. In chest x-ray, boot-shaped appearance of heart is seen in, and the options are atrial septal defect, ventricular septal defect, tetralogy of Fallot, patent ductus arteriosus. And the correct answer is tetralogy of Fallot. So let us see congenital heart disease radiology. Tetralogy of Fallot shows boot-shaped heart. Transposition of great artery shows Egon-String appearance. Total anomalous pulmonary venous circulation shows snowman or figure of 8 X-ray. And Epstein virus infection shows box-shaped heart. So let us see the next question. Milk secretion reflex in breastfeeding occurs due to the release of, and the options are oxytocin, prolactin, estrogen, vasopressin. And the correct answer is prolactin. So you should also note that oxytocin reflex is sometimes also called let down reflex or milk ejection reflex. Let's go to the next question. Temperature to be maintained for storage and transport of vaccine is. The options are 0 degrees Celsius, 2 to 8 degrees Celsius, minus 20 degrees Celsius, 20 degrees Celsius. And the correct answer is 2 to 8 degrees Celsius. Let us go to the next question. Pink color in color code classification of IMNCI guideline indicates, and the options are hospital referral, initiation of treatment, home treatment, none of the above. And the correct answer is hospital referral. So in pink color code, the patient requires urgent hospitalization, give pre-referral treatment, and refer urgently to the hospital. In yellow color code, the specific medical treatment and advice is given as you do in our OPD or clinic. In green color code, simple advice on home management like may require some homemade safe remedy. And with this, we are completing the discussion of the 2018 Kerala Assistant Professor in Nursing exam question papers. If you like the videos, please like and subscribe to the channel so that you'll be getting more updates when the new videos are being uploaded. I hope all these videos were an informative session for you. Thank you.